First, I'm going to tell you just a little bit of background, so you know why I'm even here. Been working with the state for a little over 20 years, and most of that time I've been working in drug policy. I was a forensic scientist, earned my law degree. I worked, when I was at BCI, I was a forensic scientist, and then I also worked for BCI as its director of administration. I built the Board of Pharmacies portion of medical marijuana. I worked for the ONIC, and then now I work for Governor DeWine, advising him on criminal justice and public safety. I am really excited to be able to talk about this project. We actually launched it last week. So this is a public product now, and I will tell you guys in just a little bit how you can access it, and you can follow along as I'll kind of give you some screenshots to show you how it can be used, and I can pull up a live demo for everybody to see at the same time for anybody who might not have a mobile device. I need to call our IT people. There were a couple of kinks with the mobile function this morning when I was flipping through, but it's like less than a week old, so always those things. Learning objectives. I'm going to tell you how to access it, what you can do with it, and what you shouldn't maybe do with it, what its limits are, and also maybe propose some practical uses. All right. First thing I want to talk about is really how recovery has been a priority for the governor. It's been a priority for the governor really since before he was governor. When he was Attorney General, he prioritized a lot of the work that deflection teams were doing. Some of the first deflection teams in Ohio were started with seed money that he was able to identify and use as a priority for deflection purposes. And so it's thrilling to be here today. I just told you I was at the AG's office when all of that was happening. I was working with BCI, and to see this many people here today is really a validating experience. And then we have, Core Data talking right now also about an evaluation they did about the value. They can now quantitate how valuable the work that's being done by deflection teams really is. It's impressive, it's amazing. It's humbling to stand in front of you guys and be able to talk about this. But when he came into office in 2019, these were our overdose stats. Overdoses were on the decline at that time. Obviously, we had a pandemic that was intervening between 2018 and now. We are again on a decline. At this point, though, the last two bullets here in particular, I think are really important. State agencies were really siloed. Department of Health had its data, locked up behind Department of Health walls. Mental health and addiction services, same. Medicaid, the same. Department of Public Safety, the same. And it was really difficult to use all of those pieces of information effectively. And he understood that at that point. He understood it immediately when he came into office, how valuable interacting between those agencies could be. And that's really what I'm getting at with those last two. So we needed to have cross-discipline coordination. We couldn't just look at ODH by itself or OMAS by itself or DPS by itself. We needed to get them to start interacting, and we needed to really take advantage of economies of scale. They're all executive branch agencies after all. And so the very first thing he did when he became governor was he created Recovery Ohio to pull together the recovery-related work that was being done at each of those agencies. And then he also subsequently created the ONIC by executive order. So as a law enforcement arm of Recovery Ohio. Now, since that time, the ONIC has been codified. It was codified in the last budget, so it is here permanently, and it's really been a force multiplier. I'm proud of the work that I was able to do at ONIC, and it has really grown, and they're getting the word out. They're helping people, not just with interdiction, they're helping people understand how to deflect as well. All right, so there were a lot of great things that happened with Recovery Ohio and ONIC between their creation in 2019 and 2023. That's a whole nother presentation. I want to talk about the strategic initiatives that were launched last year, but they started really in 2023. The governor knows that his time in office is starting to wind down, right? I mean, we are actively working on our last budget. He's not going to have another operating budget after this year. And so he's starting to plan out, what are our priorities? What should we be thinking about moving forward? And he challenged the group that works with Recovery Ohio to take a look at what could reasonably be accomplished before he leaves office. And that started in 2023. One of those conversations, this is a true story, one of these conversations happened at his 2023 cabinet retreat. I walked into a meeting, I was there earlier than I needed to be, and I asked if I needed to sit in that meeting, if it'd be helpful for me to sit on this meeting. I'm not supposed to be there. I sit down, and they're going over strategic initiatives and what some of these priorities could be. And then halfway through, the person giving the briefing stops, and they're like, and Erin's here, and she can tell you about this other project that she thinks would be really great and could really help the state. And didn't know I was doing that. Again, not supposed to be there. I'm like, all right, well, it's now or never. I pitched it to him at the cabinet retreat, and he told me I had 6 months to do it. So he wanted me to develop within 6 months a predictive model that identified substance use disorder across Ohio. I said, I think I can do it in a year. He goes, I think you can do it in 6 months. For those of you who have not met the governor, he is really a mission-driven person, but I think you've heard Tom Stickroth say this before. Tom Stickroth was a state employee for a very long time. The old adage is that if you work for state government long enough, you will work for Tom Stickroth. We have other people in the room who have. He likes to say that the governor is an impatient man, one of the most impatient men that you will ever know. But he knows that his window of opportunity to accomplish things is finite. And that's really what it is. So with that, the project to develop a predictive analytics and toxicology dashboard became part of Recovery Ohio's strategic initiatives. Those were publicly announced in January of last year. So a year ago they were announced. We did end up shortly, we gave ourselves a little bit of time. The cabinet retreat was before January, but we measured from January moving forward. In January, we pulled together, we developed data use agreements, we onboarded data that was not already onboarded into our common platform for the state so that all of these data sources could interact together. With these agencies. Not every agency here dedicated data, but they dedicated some type of resource. IOP did a lot of our technology support. We had mental health and addiction services. They were a funder of ours. Medicaid, they are not contributing data to the model right now, but Medicaid has really taken a close look at the dashboard 3 times. And they have really given us some feedback that's helpful and has made some improvements along the way. But the ones that are, I'll show you in a moment which agencies are giving data and what data they're contributing as part of the predictive analytics project. Do I have any questions? I want to stop for a minute. Is everybody good right now? Okay. All right. So within 6 months, we did have a model built. So by June of 2024, there was a model that was predicting where there was an increased risk for substance use disorder in Ohio by zip code. From there, we started testing it. The last thing I wanted to do at that point was release a model that wasn't tested. We needed to take time and we needed to make sure what we were doing was right, and we wanted to make sure it was working as we expected it to be working. So we did testing with our internal state partners. We did testing with community partners. Some of the folks in this room were part of our UAT. Thank you for being part of our UAT and providing feedback. But so we did that 3 times, and through all of that, our priorities remain the same. First and foremost, we want to prevent overdose deaths. Right? We want to try and save lives. And then we also want to reduce justice involvement. Justice involvement by itself is a barrier to recovery oftentimes, right? It makes it difficult sometimes to be able to drive to a job, get a job because you've checked a box, right? There's a number of things that come up as a consequence of justice involvement. And so now what we're thinking is we are able to push back our opportunity, right? Our opportunity to intervene before people make some of the destructive decisions that cause that justice involvement. All right. And what it does is it allows us to transition, right? We're transitioning from a period where the information we had left us with a reactionary response to what is now proactive. The data sets by themselves often lag. So, ODH, for those of you who look at what ODH is releasing, they just published at the end of last year their 2023 overdose deaths. That's almost a year later, right? And for good reason, it needs to be accurate. We need those numbers to be right. But it doesn't give us by itself much in the way of being able to go out and prevent those deaths from happening. So what we've done is we've developed something that, again, identifies 30 days out by zip code. I've gotten the question, if I have a zip code in my jurisdiction that has an increased risk of substance use disorder or overdose deaths, are you telling me that I should reallocate resources from a zip code that's also in my jurisdiction with a low to moderate risk into that high risk zip code? Mm-hmm.
How would you define an increased risk?
Yeah, I will get into that in just a moment, but it's a rate, and we compare all the zip codes across the state is ultimately what it is. And so I'll show you how that gets done in just a moment. And so the answer to that, and sometimes it surprises people, but I'll explain why, is no. The response shouldn't immediately be, yes, take these resources and reallocate them. I told you I was from BCI. I'm going to use a BCI lab example as an analogy. So if you have a violent crime, there's a shooting, officer goes to the crime scene and they find a shell casing. They submit that shell casing to the CODIS lab for DNA to run against the CODIS database, our DNA database in the US. If that hits CODIS, you do not have, at that point, probable cause for an arrest. You do not have, at that point, admissible evidence at trial. What you have is an investigatory lead, right? So the CODIS lab sends that back to the investigator, and this is even with DNA, right? Our gold standard in forensics. That investigatory lead, it's a strong investigatory lead, goes to your investigating officer. The investigating officer does what we all see on TV. They sit at a patio, right? Watch their suspect, who they now have a CODIS hit, eat their lunch, drink some water. They leave the water glass behind. After they leave, officer takes the water glass, bags it, submits that now for DNA analysis. You compare the DNA off of that water glass to the DNA now that was found at the crime scene. If you have a hit at that point, you do have probable cause for arrest. You do have evidence that you can admit at trial. But you had to do that additional investigation. So here, when we have a zip code that indicates an increased risk, you should do a little bit more investigating, right? you should look at it a little bit more closely. Maybe a deflection team might have a person call over in that zip code if there's an emergency department there, or a provider there, or maybe drive by some of the homeless, known homeless camps, or known drug houses. See if you have evidence of those increased risks and what they look like, and then reallocate those resources. We have had some, that's kind of what a deflection team might want to do. We have had some suggestions on what other groups might do with this type of information. We've had, the Public Defender's Office actually took a really close look at this, and it was refreshing to see what they gave back in response to their UAT, because they were cynics initially. They said that they thought probation officers could use it, not to try to change anybody's terms or anything like that, but just to communicate differently with the people who are on probation living in those zip codes. Same with parole, same with drug court and OVI court judges, not changing sentences, but communicating differently and maybe checking on people more frequently. If they're a high risk, individual on parole in a zip code with an increased risk, that might warrant additional checking. I mentioned earlier that we've been monitoring this for the last 6-7 months. The model started running in June. Every month it's retrained, so it improves. Every month the model becomes better. Each month that it has predicted the risk of substance use disorder in Ohio, the zip codes that have a prediction, not every zip code does, and I'll explain that in a moment, but it has predicted within 5, and that's an absolute value, 5, within 5 of our target data set's value, right? So that's pretty accurate. And that's every month consistently. It's done that with 92%, over 92 or more percent of those predicted zip codes. It's predicted within 5 of the target data set's value. All right, and so how are we doing it? These are our agencies or our entities that are contributing data. We have the Department of Health, the unintentional drug poisoning, so that's their preliminary findings. It's not their final findings. We also have their syndromic surveillance. I apologize. The syndromic surveillance is when somebody goes to an emergency department on admission. It's whether there is a suspected overdose or substance use involved. That's our target data set. So when I say we're predicting within 5 of our target data set, we're talking about syndromic surveillance. The Board of Pharmacy is contributing ORS dispensation data. Department of Job and Family Services is submitting unemployment insurance claims. We have 2 data sources that are not contributing to the model, but they're really complementing the model. One of those is this bottom one here. It's the Dalton Foundation. They're contributing all of their relink.org resources. Those are really resources that people can use in their area to overcome barriers to treatment. So there's transportation solutions, there's childcare solutions, there's providers. You'll see, I'll show you in a moment what all they provide. But you can access in your area what resources are available to help get people into treatment. The Supreme Court is contributing their eviction filings. In Ohio, we don't have a centralized repository for homelessness, but a close second are eviction filings. And then at the Department of Public Safety, we have the EMS, naloxone distribution, and substance use disorder encounters. And then we also have the patrols impaired driving arrests. The second data set that we are getting that doesn't contribute to the model is the toxicology data. And what that tells us is what prevalence there is. It gives us some idea of what prevalence there is of specific drugs in a county. And I'll show you how you can access that as well. We are at a point now where we're trying to see, you heard me say a moment ago that there are zip codes that don't have predictions. About a third of the zip codes each month do not have a prediction. They don't have a prediction because there's just not enough data generated in those zip codes. It's not the same zip codes every month, it shifts, but we do think we can do better than that. So we're actually working to incorporate additional data sets and improve our coverage of the state. Never expecting to get all of the zip codes. Some zip codes are just too sparsely populated. Some zip codes are just, they may not have a substantial risk, or their risk really may be very minor. And we want that.
What's the refresh rate on your studies here? Like, how often is that update?
So the model, it gets a little bit complicated, but the model's trained once a month. So at the beginning of every month,
So you're expecting all of them to provide the information?
It's automatic. Yeah, so we onboarded all these data sets, and it automatically gets refreshed at the same time. So it's on the first of every month, the model gets retrained. So the model gets retrained, so it's still thinking, the best way I can describe it, thinking the same way for that full month. But what happens is some of our data sets, not all of them, are updated each day. And so if at some point over that month, a zip code does end up with enough information that we could predict, then it would be updated. So that's called scoring. So models trained monthly, scored daily. That's a good question. Any questions about that? All right, so I'm going to invite you guys. I can pull it up here if people want to, I want to go through the slides just to kind of show you how to access it and give you some notes on things that I think can be quirky, but you're your own worst critic oftentimes, just to kind of make it easier for you all to use. But you can access it. So here's the URL, and it's live right now, recoveryohio.gov/OD early warning. And there is a mobile version, so you can load it onto. I should have had a QR code put on here. I'm sorry. So what I'm doing here is, as I go along, I'm just going to start. It's boxing in some of the relevant places. This is the landing page for you to be able to easily access the dashboard. I wanted it to be able to be accessed. A lot of the IOP, the Innovate Ohio platform web pages, they all look the same. A lot of them only have this, and on the mobile version, that's at the bottom. And I was like, no, I want people to know how to do this. I don't want them searching. So you can click the image. You can also click that top right button, and then you can click the link below. I think I might have them take the link below out because it looks really bad on the mobile version. That bothers me.
This link below?
You can click that one,
okay.
And then there.
I see that.
This, you see, this it like covers up the picture, and that.
It's great. It's fantastic. It's new. Good job.
All right, and so here is the actual product. So this is the first thing you'll see when you get into the dashboard. And this is the actual prediction here. When we got started on this project, I told the team, I do not want this to be flooded with numbers. I don't want it to be intimidating. I want it to be easy for people to use. I want it to be easy to explain. I think that they did a decent job. So you were asking earlier how we assess risk. So we break the whole state up into 5 different risk categories, and you can see the legend here. Those are low, minor, moderate, significant, and severe. They're color coded for people who are colorblind, so also should be easy for everybody to see. The way it's done is there's a risk that is scored for every zip code in the state. It is a rate, so your population matters. If we don't do it that way, then you end up with like, I think we have some people from Franklin County here, but you end up with like Franklin County being blue, or like a hotspot all the time, right? If you don't break it apart by some type of rate, you'll only see basically the 3 Cs. So we need to make it more usable and provide really more appropriate information across the state. And you'll see this is a standard way to provide information and make information usable. But then after they're all lined up, there's on the Recovery Ohio page, there is a document for anyone who wants more information on how the predictions are done or any more technical questions. We did put a PDF on there, but I'll kind of give you the high level. After they're all lined up, they're looking for basically like 3 different characteristics of each one of those. And if you hit various numbers of it grows very complicated very fast. So I apologize. If you hit 2 of those 3 categories, you become severe, and then they move down from there. There's an image that shows how this is done in the document on the Recovery Ohio page. I think that's below the map if you're scrolling on, and I can pull it up here too to go over that with you guys in a little bit. Is that helpful? I know it's not going into a ton of detail. Yeah, for the how.
I had a secondary question too. Why did you pick zip code versus township and villages and like the kind of those municipal lines?
Yeah, so for a couple of reasons. First, zip code is something that is tracked kind of broadly across. We had to harmonize a common denominator across all those data sets, right? And so we could do it with zip code. It gets difficult with some of the data sets because they just don't have that much detail when they come across. The other thing is that we had to sign DUAs with all of these agencies, and in order for the agencies to be able to participate and be data contributors to the project, we had to present it in a way that made it unlikely. I don't want to say impossible. I feel like every time you say impossible, you've dared somebody to, prove you wrong. But to make it unlikely to re-identify somebody, right? So we can't identify individuals here. I'm going to say this to you guys. I have spinning around in my mind. Now we, again, have a finite amount of time to accomplish something like this, so no promises, but spinning around in my mind, the possibility, and I don't know, it's just an idea, it's just a concept right now. This was built in a year. To create a role that would be limited to like deflection teams or something like that, so that they could get access to more information. We have additional data that's running in the background too. I get reports on a regular basis that show me which zip codes over the last 3 months were consistently high, which ones were consistently low, which ones from month to month dropped more than 2 risk categories. So all of that's running in the background too. So there's more information that we have that we can provide. We need feedback from people. We need to hear from people to know it's useful. We need to know, how you could use this if you had a little bit more information. And also, if it's useful and you want it to continue to live past these next years, knowing that it was useful is helpful as well.
Quick question. This may not be relevant to our current discussion, but with the data that you have running in the background, are you able to tie that back to like maybe supply or things of that nature? I know we're not trying to be law enforcement focused, but if you have access to that data, are we able to if you're seeing hotspots and you're getting data about what people are using or substances that may be harmful, like tainted, so to speak, are we able to, do we see trends that you could tie back to supply and distribution?
So that's probably going to come more in the toxicology piece, right? So that's going to give you the prevalence of the specific drugs in each county. It's also that those are from forensic labs, right? So one of the things I'm working on actively is right now the only thing we have, and this will help with, this could help with interdiction as well. Right now we only have toxicology findings from the patrol, which is helpful. It gives prevalence data. But one of the most frequently asked questions I get about that page is, well, I don't see xylazine. And yeah, so it's toxicology data. Toxicology data, and I apologize because we were not there yet, but toxicology data is different from like seized drug data from a crime lab, because toxicology data tells you how much of something is in it. Drug chemistry data tells you just what's in it. It's a qualitative analysis. So drug chemistry can do general screens without doing an individualized method for every analyte they see. So xylazine's new enough that you're not able, so xylazine's new enough that you're not, they don't have a method for confirming xylazine in the toxicology lab. So one of the things that we are working on actively is getting data from all of Ohio's drug chemistry labs and getting them into that page, so that we'll see then all of the nitazine compounds. We'll see xylazine. Anything that your drug chemistry section is identifying would then be there, and it would be there for all of the state labs. Mm-hmm. All right, and so you can filter this map. You can click on the individual, if you haven't done this already, you can click on the individual zip codes to get some information on those. You can filter based off of risk classification, zip code, or county up at the top. And then I also want to call this out here. So this is the first instance where you're going to see some of those recovery resources that are provided by Relink. These here that you see on the landing page are the top 5 most requested resources across the whole state. If you select a specific zip code or zip codes, it's multi-select, this will change and you'll see which are the most frequently requested in that area. So it can kind of help you to focus attention on what people might need. Mm-hmm.
And this is based on what people are looking up on Relink?
Mm-hmm. Mm-hmm. Yeah, I had talked at one point about trying to use like ODA's social determinants of health. That's a whole nother project. They track that on census, and so we'd have to convert census to zip code. It quickly snowballed.
For like utilization of Relink, you know, is there a way to measure that? Because I feel like a lot of counties, I work in public health, so a lot of counties have conversations that are like, you know, we want our own website, we want our own linkage network or something for community resources and things like that. So like, can you see utilization too?
How much is being used on
Yeah,
Relink?
like for instance, like I live in Lucas County, can I see how many people would even use Relink in Lucas County?
So they have metadata that they're using, and that is actually how we're coming up with this here. They gave us an API, so all of this data is actually directly from them. So yes, Relink has that. We don't have the ability to share that outside of that, but you can see what people in that area are actually requesting or what's being requested. It is actually people, it is people in that area, what they are requesting. Is that helpful?
Yeah, I'm just trying to like, you know, I'm just thinking of, you know, as different agencies were sending people to different, we have our own, you know, crisis care center who is using their own, you know, that's kind of a hub for how we do some things. So I'm just curious how many people actually are using Relink. Like we've explored Relink
We had options, right? We could start something from the ground up, which would take, that's a monumental task, right? And they've been doing this for close to a decade now. So we chose to leverage what they had available to them. What I will say, if there are resources that are not included on here, they have agreed, and we have contact information you'll see in just a moment. Let me get to that and I'll show you where the contact information is, because it is important that if there's a resource that's not available, that it get added, and if there's a resource that is no longer available or it shouldn't be available, we need to know that too. So once you filter, I filtered on 2 zip codes in Franklin County. One's just east of downtown with a minor risk classification. What the orange zip code here is downtown, so this is where our state house is located. It's a severe risk classification. One of the questions I often get is, can I Zoom? I don't think that you can Zoom on the, it doesn't automatically Zoom, I'll say that, on the mobile app. But the way you're going to do it, there is a menu up at the top where you can zoom in and move. You can manipulate the map that way. This is how you do it on the actual screen or the computer version. This is here to show you how to navigate across to the additional resources that are part of the dashboard. So again, this is your desktop version. On your mobile app, there's a hamburger menu where you can select the additional resources. So this now, you could have selected any of the 5 resources that were on the homepage, or you can select up at the top where I had the box, the recovery resource locator. And so this is our home screen for the resources from Relink. I mentioned just a minute ago that we really do want to hear from folks, and Relink has agreed to make changes if folks make them aware of anything that is missing. They're happy to add it, or anything that shouldn't be there. If you know there's a bad actor or somebody who is closed, we need to be aware of that as well. And so here's the contact information. You have both an email here and you have a phone number that you can call. But defaults to the whole state. You can see how many resources they have available in the state. You can filter this as well. You can filter up at the top by zip code or mile range. And then from there, here I entered a zip code from Hamilton County. This was actually a zip code, it's 45248. This is a zip code that made a big jump. It went from a minor risk to a severe risk in one of those reports I was getting over this last month. So I entered that in and I changed the mile range to 5, and I selected the 3 different service types. So again, that's multi-select. You could also filter an organization name if there's a specific organization that you'd like to use in your zip code, or you can filter it based off the population served. One of the things, and I didn't do this on the first page, that you're going to want to do, I can't go back. Yeah, I can, there we go. You're going to want to do, when you select those, make sure you hit apply. It's a Tableau server. We're limited kind of on that functionality, but you got to hit apply. You're always going to have to click it to tell it that you've made your selection and this is actually what you want to do. And so this one does automatically zoom in. You can see I got 68 results, and it gave me a list of all of the organizations available in that zip code that met those service types that I had entered. Any questions about this before I move on to toxicology? I want to see how I'm doing on time too, sorry. All right, so this is the toxicology insights page. Again, I mentioned we are working toward, I'm interested in your feedback. We are going to at least be adding the chemistry data. We may be replacing toxicology with chemistry. So if there's still a utility for the toxicology for anybody, let me know. That'd be helpful to hear. I'm not sure if it's going to be confusing to have both, or if there will be value added for folks. So this may be replaced with the chemistry findings once we have that all onboarded. Up at the top, I tried to include in the dashboard the things that I get asked about all the time. I got asked about them when I was working as a forensic scientist. They get asked about them all the time still. And so I did get some feedback from some of my colleagues who I've known for a long time in crime labs who are like, can you please just answer this question for us so that we can direct people to, So that's what we've tried to do here. These are the top 3 drugs across the whole state. These drugs here, I want to make sure you know, the number that you see associated with them in the top right-hand corner is the number of times they appear anywhere in a lab report. It doesn't matter if they appeared by themselves or if they appeared in a mixture. That's different from the rest of the page. But you do see here, this is the first time, I think last month might have been the first time, but fentanyl is not one of the top here for the whole state. So that has changed at least from what Patrol is finding in its toxicology samples. They obviously test a lot of OVI cases, but they also they've tested for over 400 local law enforcement agencies too for various crimes, and those don't all have to be OVIs, but these are the analytes that they are seeing most frequently across the state. If a county is blank, they have not tested and produced any findings from that county.
The training insights, can that go like zip code by zip code, or is that just going to be cumulatively the entire state?
It can't. It can go county by county. So the way the Patrol tracks there, and this is going to be true also for the chemistry labs. So they don't necessarily have a zip code that gets entered, and if the zip code does get entered, it's going to be a zip code of the law enforcement agency. And so the zip codes is associated with the lab reports isn't necessarily going to be informative. So we've left that at county level.
So if I selected like a county, that would change to reflect that.
Yeah, and I'll show you that in just a second. Yep. And so right there is where you can actually filter. That red box that just appeared. Do you see that? And so that one is multi-select. Again, Franklin County and Adams County are what I selected for this one. Click apply. This one does automatically enlarge, unlike the home page that you have to do separately. This is one where I think might be getting at the heart of your question, actually. I boxed that in because it's not super obvious, but you can pull up a separate chart if you click there that compares the counties that you've identified, that you've selected. And you want to make sure that you're clicking like right here. I couldn't make it appear here, but there's going to be a plus sign that appears there when you hover over the end of that arrow that'll pull up that comparison. So right now, the only thing you're seeing, and I want to call this out too before I click again, here the only thing you're seeing are specific mixtures or individualized compounds as they appeared. So whereas the top was each time any of those analytes appeared across the whole state, this is more specific here. This here is going to tell you amphetamine and methamphetamine appeared alone 84 times in those 2 counties, in a common mixture alone. Amphetamine was isolated and the only analyte found 39 times. Cocaine, 94 times. And then you can scroll down to see more analytes. So over the past, 8 years or so, we've been seeing some extremely complex mixtures come up in drugs, right? People are consuming things that they can't possibly know they consume oftentimes. And one of the things that I get asked a lot is, well, how often are you seeing drug X with drug B, right? People don't want to just know how many times a single drug is appearing. They want to know how many times these are appearing together. And so I asked the team to build something in so that people can answer that question. You can select up to 5 different analytes here, and it'll pull up how many times those 5 analytes, or however many you select, appeared together. It's going to tell you, and I'll show you, because I select this here in the first drug. You see I'm selecting methamphetamine, and these are not multi-select, you can only select one at a time. So you see I select methamphetamine there. I did select a second drug, fentanyl-related compounds. So now this is going to tell me how many times methamphetamine and fentanyl-related compounds have appeared together. And it's appearing in the compare counties table that I showed you earlier. What you'll see is when I select these 2, methamphetamine and fentanyl-related compounds, it's not limiting just to those 2, it's when those 2 appear in a mixture. So here you'll see it's fentanyl-related compounds, methamphetamine, and amphetamine. So when people are taking those 2 together, they're most frequently taking it also with amphetamine. In Adams County, in these 2 counties. Adams County, it happened 4 times, Franklin County, 14 times. And then you can see again here, you got buprenorphine added to this one, and cocaine. The third one, we have gabapentin and amphetamine in there. Mm-hmm.
I'm sorry, I got this. Is this based on decedent toxicology or BCI toxicology?
So BCI actually doesn't do toxicology. Oh, okay. So that's why we selected we had 6 months to build it. So we went with the patrol's toxicology lab because they're the only statewide. So it was if we had to pick a single source of information, and we did in order to move quickly, the way we could do that with the fewest data gaps was to go to the toxicology lab at OSP.
So is that like drug seizures or like drugs found on?
No, it's actual toxicology. So these are specimens, biological specimens. That are, so it's
from like ODAs.
Yeah, so like, it's blood, and it's blood and urine predominantly.
What's the lag on it? So from the time they collect it to when it's tested and then you get the data, how long is that?
So they update daily. I believe it's daily. And that, I'll pull it up in a second to make sure I'm not lying to you. I'm fairly certain they're uploading daily. They told us they could do it daily, and I think we accepted daily. There is a document on that Recovery Ohio page that'll tell you how frequently each data source is updated. I think theirs is daily, and I'm sorry, I'm pulling off the top of my head from 9 different data sources. So they refresh daily, but we have to wait for it to be submitted and tested too. So if that was your question, then you're relying on turnaround time at a lab. So it's about 45-ish days. I just got their most recent report this morning, but I think they're right around 45-day turnaround time. It fluctuates.
Just to piggyback on that, so since it fluctuates though, and it varies, as soon as it's available, because the systems are being stored daily, as soon as that information is available, it's hitting.
As soon as this comes available, it will. So this doesn't. There's no scoring or model training associated with these. It would the numbers would just be updated. Yeah. The only thing, because this is one of the data sets that complements the model, it doesn't contribute to the model. Yeah.
Gotcha. Thank you.
Mm-hmm. So the data we're looking at, you said, is from OBIs, anything local BD submit to the state lab, but it's not DOAs, right? It's not coroner related.
It could be.
Okay.
It could be. If they had a fatal crash, and a hospital drew blood, and that blood went to the lab, it would appear here.
Say it wasn't a car crash, just on a DOA in a house. There's a very small possibility that data will wind up on this database.
It's less likely under those circumstances. It could, but it's a lot less likely that would appear here. And so that's part of what we're trying to do by going to all of the drug chemistry labs, right? So it's going to cover more of the state, right? I mean, So you have, we're working with Hamilton County Coroner's Lab, right? We're working with the Cuyahoga County Coroner's Lab. So already, those data sets are not included here, but we would get those in the drug chemistry. They've agreed to give us drug chemistry. Cuyahoga has been like really kind in offering like whatever we can do to help you. If you want our toxicology, add our toxicology to this, and we can figure this out. Yeah, let us know what you need from us. So they've also offered their toxicology to us.
What would be the difference between if we switched over to, I forgot the word.
Drug chemistry?
Yeah, drug chemistry. That would be what the difference.
It's the type of sample tested. So toxicology is the biological specimen, right? The drug chemistry is your evidence that was seized, like a white powder. It's the actual drug that's tested. And those are not going to tell you, because those they don't test in Ohio except for marijuana, because marijuana has to be the most difficult thing to test for anything anymore. Sorry. But they don't tell you how many, they don't tell you how much of a drug is in a mixture when they get it. So they can broadly tell us what it contains, unlike toxicology. And so at that point, we'll have more state coverage and we'll have broader drug coverage. So we'll really know more across the state what the prevalence is. And for those of you who use NIFLS, it'd be really similar. They're telling me I have 5 minutes. It'd be really similar to what you can find in NIFLS. The difference is NIFLS is password protected and not a lot of people have access to it. We're making this available to everybody. You can request all this information from crime labs anyway. I think BCI turns it out on request on a regular basis. All right. So practical takeaways. We are predicting now 30 days out by zip code. So this is happening, it's being refreshed daily. The model's being trained and improved monthly. We know our predictions are accurate. Again, we have over 92% of those zip codes that have a prediction are within 5 of our target data set, within 5, like absolute value. Like that is something we're really proud of in this product. And it's intended to be an investigative tool. There's no easy button. I tell people this all the time. The drug epidemic is a complex issue that requires critical thought at every level. And we don't pretend like this is going to solve all the problems, but we're trying to get data that can be used into the hands of people who can action it and make it available to you. And again, this is for you guys. So if there's another way the data can be presented, or if there's additional information that you think could be helpful, or if you're using it and it's valuable, let us know so we can continue to make it available to you and have a reason to continue to make it available to you. We want to know these things. Yeah.
Not to be adding to your, technical difficulties with trying to get things started, or what, is there a way to do like an alert system, or maybe register for like alerts in your zone or your zip code to say, hey, the data's coming in and your area is going to see an uptick? Or
so we've batted around how to do that without flooding people's inboxes and making it something that no one pays attention to, right? Yeah. I've talked with Dennis Lowe about a project that they're working on and maybe tying that in here. I don't know if that's an option. Again, I'm not wedding anybody to anything. These are concepts right now, but that's something that we have batted around and that we think could be useful to people, but we've got to be thoughtful about it and make sure that the information that alert is providing is helpful, and B, we're not over alerting people.
One of the questions I was going to ask, but it seems like it might not be like at that point, was a lot of public health agencies have community response plans for overdose alerts for overdose searches. Is there a practical way to integrate these predictions into those community response plans potentially?
Like from ODH, what goes out, or?
Yeah, so like for instance, like we use Epicenter, so like the syndromic surveillance, but we also use overdose run reports from our local fire department, EMS provider, things like that to kind of determine if we are seeing any elevated overdose activity. But this almost seems like it could be used like as a component of a community response plan potentially, or that agency is taking the lead to be the person who's sharing that information with other key agencies.
So that's something we can definitely talk about. Why don't I give you a business card, and we can connect afterward and kind of talk through how something like that could work. At least so I have a thread that I can pull and start talking to our folks over at ODH and
Because
us.
ODH is, there's a reason a lot of the counties do have these plans that was part of a deliverable and emergence or something like that.
Yeah.
So,
And Dr. Vanderhaal's been great, and his team has been amazing, offering feedback and, well, this would be clearer if you did it this way. Like they're great at that. So yeah, I'm happy to talk to him about it. So.
Are you going to put up your
Yep, contact
Thank you.
information. I did not do a live drive through of this, but hopefully some of you guys were able to pull it up on your phones.
Was there a specific app, or was it just all web-based?
I'm sorry?
Was there a specific app, or is it all web-based to access?
It's all web-based. Yep. But all right, I think that covers it. If no one else has any questions, again, we have another question.
So is there any filtering of certain zip codes or anything out? Because there's kind of like in Summit County, when you look at the map, there's a zip code in this other part of the county that like lights up with a significant risk. When you hover on it, it's like not a zip code I'm familiar with.
Okay.
And then when I Googled it, it looks like it's just like a post office post office box zip code or something.
Okay.
But the way the map looks, it's like highlighting a larger portion of the map than I think it actually represents.
Okay. Will you give me, so you have my contact information. Ping me on that one. I don't know if that's if that's a quirk right now that they need to go back and fix on that one or not. I'm hoping, sorry, we're at the end. One of the other things that I'm hoping to do, because we do have some zip codes that are consistently over or under predicted. And we need to do a better job with those. We are replacing the OVI arrests with the BMV's administrative license suspensions, so that now we'll cover the whole state with a lot more data points. So we're hoping to be able to make it even more accurate after that and cover more zip codes. So that could end up fixing that too. I have to see what you're talking about to be able to help you out with that one though. Sorry. Is it a border? Is it on a county border? Sorry, we can talk about it.
It's on a post office, so I'm assuming it's like post office boxes or something in another zip code. But just when it's mapped, it looks like it's large. So I'm like, I shouldn't be seeing this zip code with a high risk because it typically doesn't have that. But then in the detail, I'm not familiar with that zip code. So, but
Yeah, let me know. All right. Well, thank you, everybody. I really appreciate being able to be here today. Again, being able to work with you guys. A lot of you guys have taken me out to show me what you guys do and so I can experience firsthand how deflection works in Ohio across multiple counties. And it's humbling. It's truly humbling. You guys are making a difference. Thank you.
Thank you.